presenter. Everyone already knows who she is, but Prof. Malabika Sarker is Associate Dean and Director of the Center of Excellence for Science, Implementation Scale-Up at BRAC, James P. Grant School of Public Health at BRAC University. She also currently holds a position as an adjunct faculty at the Institute of Public Health Heidelberg, and of course she's our main organizer of this meeting, so we thank her very much.
Thank you, Deborah. So actually, I think my presentation is very complementary to Vijay's presentation because Vijay has presented all kind of ethical dilemma that we kind of suffer from or experience when we do the implementation research. And I'm going to kind of share some of the key challenges that when we try to conduct implementation research in national setting. So just to kind of refresh that what is implementation research. So it's the scientific inquiry into questions concerning implementation, the act of carrying an intention into effect, which in health research can be policies, programs, or individual practices. So very simple term, it's like a close the gap between the, the evidence and the routine practice. So that's the important thing. So what are the steps for implementation research? So I'll just go through the steps and then discuss about our struggles in conducting implementation research. So when we, unlike implementation research, it's like a researcher's kingdom. We are the king or queen. We formulate our research question, and we have our funding. We go, collect data, do the analysis, publish. That's it. But the major backbone of implementation research is actually stakeholders' engagement. Here it's not the king or queen who will rule their kingdom. It's like we need the partnership. We bring everybody to the platform and discuss with them. So the first problem with the stakeholders' engagement, and stakeholder, it includes all the implementer organization or the government or NGOs, the bilateral donor parties, donors, the community, is that most often that they do not have a research mandate. I'm kind of a little bit blunt here because there's a tendency that in the morning, in different sessions, we found that we have the tendency to scale up without thinking of the context. So whenever there is an efficacy or effectiveness trial, we bring it, and we never think about the context. And even Bangladesh, which is a small country like pancake, and not that much geographical problem, but we implement the same program in the mainland to the coastal area to hill tracts. So this research mandate is not often the priority of implementing organization or bilateral agencies or even the donors. The secondly is the availability of research, because implementation research is not very kind of a sexy efficacy or effectiveness. So whenever it's about the implementation, it's a lot of dirty works. So the availability of research and understanding the importance and allocate the research for implementation research sometimes is difficult. And if you can look at that currently, that this is the first global conference and many of us are here, but many of the donors are not here. Many of our partners are not here. So that also reflects that how important is actually to the stakeholders, the implementation research, because we need to think about one of the major things, that end user strategy, because implementation research is all about implementers and improving the program and kind of an improvement of the life of the community, not only publishing in Lancet. So secondly, that one of the second element of the implemented research, that research question needs to be formulated in collaboration with the implementers. Again, it's not the researcher who will come up with one morning a great idea and formulate a research question. We need to have a communication and partnership with the implementers and the formulator of the research question. So what is the challenge there? One of the major challenges is that difficulties in identification of the topic. One of the major reasons is absence of the data or the quality of the data. And the secondly is the critical analysis of the data, because the expectation is that implementers will actually come forward with the research question and kind of try to build a partnership with the researchers and the donors. So most often it doesn't happen because I was the implementer for 10 years in BRAC, and then I'm an academic. And when I was in the programmer, so we lack the critical analysis, how to look at the data, and even we're not allowed to look at the data because the researchers from Dhaka head office will come and conduct the research because they are the one, the elite one. So the bridge between the researcher and the implementers are still actually lacking. So as implementers, it doesn't matter how smart and mid-level workers at the field level, they need the guidance and the mentoring to look at the routine data and identify what is the critical problem. So most often what happens that we have some money for the evaluation, and later on they come and do the evaluation. The train has already actually left that station. So already the program has been finished. So what's the point of those data, like, the result which is published? So that is one of the major gaps when we want to conduct the implementation research. Secondly, when we have the data, how can we prioritize the problem? Because again, the resource is limited. So if we want to do, then we have to prioritize the problem. And the prioritization of the problem is sometimes it's based on the low-hanging fruit, that whatever the problems we can fix easily, whatever that can actually long-term damaging. So there's too many pressing issues. So the prioritization is that sometimes we struggle, the implementers of the struggle, because everybody has their own love. And for that program component, they want think this problem is very important. But so it's another communication as a partners with the stakeholders, that how can we come up with this, like a very specific and prioritize the problem. Sometimes you come with a broader problem, which might not possible within the implementation period. Because another challenge is that implementation research is only useful if we can actually come up with some of the outcome during the implementation. So if the project is finished, there's no point. So that's, again, another problem, that if we come up with a broader problem, which needs actually much more macro intervention, we can't prioritize the problem. Secondly, the selecting the right theoretical framework, because implemented research is still now very young. Like, it's like a very new black in town or orange in town. So although, yesterday we listened to Lara Damstroder, she came up with CFIR, but there should be more framework, because implementation research is context specific. So whatever Laura's framework CFI is not maybe applicable for the humanitarian crisis setting. Even within humanitarian crisis setting, the Cox's Bazar and the Syria are not the same context. So this is very important to come up with a wide range of framework, and we need to invest in that how can we come up with different framework so that we can collect the data and actually analyze it critically. Then the research design. I think Vijay has kind of elaborated, and yesterday Nan also said that implemented research, we think, oh, that's a soft science. We can do some FGD, few IDI, look at the data, that's it. It's not actually the kind of a hardcore science or epidemiology. But if we look at the kind of a different design, and Donna Spiegelman is the one. She's leading, she was at Harvard before, now at Yale, and she's as a biostatistician, she's actually looking at the different kind of design. And then if you look at the implemented research, we can use the cluster randomized control trial. We can use the stepwise design. There is adaptive complex design. There is also smart design, sequential multiple assignment randomized trial, or hybrid effectiveness implementation, which Vijay has talked about. So there are a lot of opportunities, and a lot of methods are available. So there is a possibility. But all these methods, if we want to use that also requires kind of resource, because not only with the finance, but also the capacity, but also the willingness of the implementers. Because I know that as an implementer, I was on that side of the table, we are very possessive about the program. So whenever the researcher come, like in my lifetime when, the Professor Masood, the Professor Kausar Afsana, when they were in BRAC Research Division and said that, oh, we are coming to Dinajpur, we are like, wow, they are coming to police actually. So policing is in implementer's mind that the researcher coming to find flaws. So the mindset of implementers is also not that open that this is actually equal partnership. This is actually benefit, can be beneficial to our program. That's the purpose. So yesterday I know that John actually place the question that the communication, I know that Ayman was like vigorously protested, that's not a problem with our other academics, but I do agree with John. There's not the communication. You have to be open our mindset that we also researchers are not king and queen or elite, that there also are the implementers are here with the, like all their sweating and then working in the field, and we are the people, know everything. So there have to be we need to create an enabling environment where we can have mutual respect, mutual trust and faith that our goal is actually same. So that's one of the, I think, very important. So we need to kind of, that the myth is IR is only about some qualitative data or soft science. I think we really have to kind of, I would say that, abolish it or from this. So that there are a lot of constant, because it's an emerging field and not mainstream yet. So the first is the gap in understanding of importance of IR. We talked about the resource limitation, not feasible in all settings. It's very difficult. We know that some of the research we are doing in the cost budget with UNICEF, we know how difficult it is to do the implementation research in a humanitarian crisis setting. But most importantly, there's also poor capacity. So Brack James Pigden School of Public Health is fortunate enough to receive the TDR grant, for capacity development. And every year, when we want to find supervisor to supervise for the implementation research of the MPH, we can't find. There are only 1 or 2 persons. So it's not only even the faculty level also, there is a gap in the poor capacity. Actually, we need to address that. Lastly, it's very complex. So I think for implementation research does not require only IQ or intelligence, but also EQ, emotional quotient, because you need to engage the stakeholders. And going back to, again, John's concern about the communication, if our emotional quotient is not high, sometimes not very much for researcher actually, I'm sorry, that actually is very difficult to conduct the implementation research. But of course, there are potential solution. Definitely, it's not that mission impossible, because we are doing that, and you listen to Kunle, you listen to many presentation list today that we are doing that, and we are doing that in partnership with our the stakeholders. So implementation research literacy is very important, because that's very important, and that's why we need the advocacy. With our video, we need a policy dialogue, we need conference like that, so that we can create an environment and actually spread the implemented research literacy. Creating a critical mass, and we know that TDR is doing that. That's one of the peer organizations that trying to develop a global critical mass conduct implementation research, and I do think that other organizations will also come forward, because one of the shortcomings of the TDR research capacity is that it's actually focused on the neglected tropical disease. So I think we expect that in the morning, that NCD panel that they're doing in the NCD capacity building, but there are many emerging issues like NCD, climate change, road traffic injury. Those organizations also need to kind of step forward like TDR and start developing actually the implementation research capacity among the researchers who are engaged in those research. There is also conducting implementation research in the ongoing program, and there's I think UNICEF is leading that. I think UNICEF, Deborah is here, that they have a research wing in New York headquarters. And we are, even at Bragg James Pigden School of Public Health, we are actually engaged in series of implementation research. So there's a reason that why UNICEF and TD are a partner of this conference actually, because they are actually encouraging their implementing organization and engaging implementing organization to conduct the research. We also have USAID. Some of you in the HARD program that USAID also stepping forward. But we do need other donors, the local donors, not only the international donors, to come forward and encouraging implementation research by engaging their implementing partners. Then stepping towards sustainability is very, very important. And one of the, I think when I was an implementer, that time the evaluation was some kind of, I remember that I was in Bragg and maternal MCH program, Dinatpur, I was working. first as a physician, then as a manager, that at the end of the program, few like Lincoln Chen and others from Harvard and London School of Economics came and have done some interview, and that was the evaluation. So that was in 1991, 92. But the evaluation is now actually converges to research. And we know that monitoring evaluation is now the framework for most of the project, not only in terms of the integrating in the planning, but also allocating research. So I think our goal should be, if we think about the future, that having implementation research as an integrated component of monitoring evaluation framework and allocate budget from the very beginning before they start the program. Because that's the only way we can ensure that implemented research can contribute in actually creating improvement of the program and contributing to the, that better the global health. And secondly, the allocating the budget is very important, because that's another challenge, I would say major challenge, that because each program has already this budget allocation. And I think UNICEF is very unique that they kind of, I don't know how, manage money from here to there and encouraging to conduct the implementation research. But we do know that there is a limitation. It's every single line item. And suddenly somebody cannot allocate $20,000, $30,000, $100,000 to conduct the implementation research if it is not allocated, before that when we are planning for the project. So I think that's another advocacy we should do. That should be, I would say that as my dream, to see that in next 5 years that implementation research is will be an integral component of the monitoring evaluation framework and budget allocation. So that's, I think, the challenge that we have gone through. But I just want to say that, when I was preparing that, I have not given so much attention to the ethics. So thank you, Vijay, because I think your presentation complemented that continuous challenge in terms of the ethics when you conduct implementation research. So thank you very much.